Hi, thanks for joining. I'm Kelly Robinson, the Director of Total Rewards, and today we're going to run through benefits and compensation considerations within a job search. So we're going to cover helpful medical terms when it comes to insurance that might be helpful to know. We'll take a look at what you should think about when choosing a medical plan. We'll look at some other perks and employee benefits that are offered out there, and we'll run through retirement benefits and give an overview on that. And then we'll also talk a little bit about compensation terms and how to evaluate job offers. So when it comes to medical terms to know, when you're enrolling in a health insurance plan, a provider is typically a hospital or a doctor's office or some kind of healthcare location or service. The insured is the person who has the health insurance coverage. The premium is the amount of money that you pay per paycheck if you're paying insurance premiums for your health insurance or your dental, for example. It's the amount that's coming out of your paycheck. And a lot of organizations allow those premiums to be paid on a pre-tax basis so that you don't have to pay taxes on that money. A copay is a set amount that you might pay when you go to the doctor. Let's say for an office visit, they may ask for a $25 copay. The deductible is oftentimes associated with certain health insurance plans, and that is an amount that you have to pay in full out of pocket before the health insurance plan will start to pay. So it could be $1,000, it could be $500, it kind of depends on the plan. But the lower deductibles are generally, if it's a lower deductible, it's a higher cost per pay period. And co-insurance is the share of your cost that you would pay after you've met your deductible. The out-of-pocket maximum is something that most plans have in place, and it sets a limit where it's the most you would ever pay for healthcare expenses for the entire year. And so once you reach your out-of-pocket, then the plan would pay 100% of any medical costs. Preventive care are your annual checkups and screenings and potentially immunizations. Those are all covered at 100%, so those are not subject to deductibles or copays. So things to think about when you're choosing a health plan or deciding whether or not you need a separate health plan is, if you are under the age of 26, you may be able to continue your coverage under your parents' plan until you turn 26. Another thing to think about if you are going to select your own plan is a choice of doctors. So do you want flexibility in who you see? You want to think about how many doctor visits you might incur each year. You know, do you go to the doctor a lot or not very often? Prescriptions, any prescriptions you are taking or may plan to take. And whether or not you would prefer to pay more in premiums out of your paycheck and then less when you receive care, or would you prefer to pay less out of your paycheck and then just know that, you know, if you're going to get care, you may pay a little bit more. So there's some different kinds of plans out there, and one is called an HMO, and HMO plans are generally cover certain providers. So there's doctors that decide to participate in an HMO plan. And so with the HMO plans, there's no out-of-network care. So you can only see providers, so doctors, or go to hospitals that are within their network. And they do require that you select a primary care physician. And in order to see a specialist, you would need to get a referral from your primary care to see specialists. So that's what an HMO is all about. And then a PPO offers you a little bit more freedom as to who you see. So there's often an in-network and out-of-network option with a PPO plan. You also do not have to choose a primary care physician to to be enrolled in the plan. However, it's always a good idea to have one. And then you also don't need a primary care physician to write a referral for specialists. As long as the specialist is within the network, then you can see them directly. The costs for the premiums that you pay out of your paycheck tend to be higher for a PPO plan. High deductible health plan is where there is a quite large deductible that you meet before the plan pays. So The deductible could be $1,000 or $2,000, and that's something that you pay. Any healthcare expenses are paid towards that deductible. Once it's met, then there's either copays or sometimes much more available coverage under the plan once the deductible is met. There's oftentimes a health savings account related to a high deductible plan, and the HSA or HRA, another option, allows for you to set aside money to pay for out-of-pocket expenses. So it's a savings vehicle for that. So the high deductible health plans tend to be lower in cost from your paycheck. And so something to consider for sure. So some other perks to think about or other benefits that organizations offer, financial well-being. So something to take a look at is, what are they offering for tuition reimbursement? Do they have any student loan repayment programs? Is there time to attend, classes? Are there retirement planning services or advice or online tools? And then we'll talk a little bit more about the 401ks, 403bs, matching as well. And then think about the work schedule. So is there flexibility to work from home, or is there a flexibility to do a condensed work week? Always important to find out how much vacation time, holiday time, community service days, all of those things. And then leave of absences. So here's just one example of a type of leave of absence, but there's other leave of absences that organizations offer as well. So always a good idea to take a look at that. And then are there any other kind of on-site or virtual offerings that the organization might have that might just make things a little bit easier? Life and disability is another component of the benefits that are often offered to employees, and organizations tend to, if your benefits eligible, pay for a life insurance policy, a basic life insurance policy, and then allow employees to purchase additional amounts under life insurance. And so there's oftentimes disability insurance as well, so both short-term and long-term, so for a shorter-term absence. And then if somebody was expected to be a little bit longer, then there would be long-term disability as well. So something to just inquire about and understand when you're looking at benefits. And voluntary benefits. So then we just kind of covered the core benefits. We didn't talk about dental or vision, but those are two, major components within a benefits plan, which are listed here below. But then there's a whole other host of other options that often organizations will offer. So there could be discounted auto insurance or pet insurance. We talked a little bit about additional life insurance, disability. Sometimes there's a legal plan that's offered you can enroll in. Pre-tax contributions to an FSA or an HSA, so that allows you to set aside pre-tax money to pay for your out-of-pocket expenses. So these are just some of the things to think about and take a look at. Moving into retirement benefits. So the retirement plans that are set up out there through organizations are allowing you to save for your future retirement when you're not receiving a salary anymore. And so there's different plans out there. There's 401ks, there's 403bs, 457s. It all kind of depends on what type of organization you're working for. A couple of things to think about when it comes to the retirement plan is eligibility. So it's good to understand, when can you start contributing to your plan. Sometimes there are waiting periods, sometimes there's age limits. You need to understand whether or not you can contribute on a percentage basis or on a dollar amount. So just when you're setting up a contribution amount, you want to understand how that's going to work and how much is going to be taken out of your pay based on what you elect. The IRS sets federal limits each year on retirement contributions. So in 2021, if you're under age 50, it's $19,500, and over 50 is $26,000. And then some organizations offer auto enrollment, which means that they will take out a certain percentage of your pay upon hire or upon reaching eligibility, and start contributing that into your account. And so you do have a time period to opt out of that, but an example of this might be that they're going to set you up to contribute 3% of your pay upon eligibility. And then you have the opportunity either to increase that amount higher or stop it altogether, for example. So something to be aware of. And then there's a couple of different ways you can contribute to 403Bs and 401Ks. You can do it on a pre-tax basis, which means that you are not paying taxes on your contributions as they're going into your account. But when you withdraw them, you pay taxes on everything. So you pay them on your contribution amount and any earnings. The Roth contribution is a different way of doing it. And that is where you pay taxes on your contributions during the time in which you're contributing them. So you pay them at the point in which you're contributing, you're paying taxes. And then as your money in your account grows, when you take a distribution and you take that money out when you retire, you do not pay taxes on that money, and you don't pay any taxes on the earnings as well. So there's a couple of provisions to that, which is that your account has to be open for at least 5 years since the first dollar went in on a Roth basis. And that you are at least 59 and a half years old when you take a distribution. So, but long-term benefits to both, really. And then other terms to know is an employer match. So there could be organizations that will, if you contribute a certain percentage into your account, they're going to give you a percentage into your account as well. So they might say it's 100% up to 3%. So if you contribute 5%, they're going to give you another 3%. So that's something to consider as well. Vesting. So the vesting is that any money that you contribute is always 100% vested. So that's something to be aware of. It's just that the organization contributions can sometimes be set on a schedule. So it might be based on years of employment. It might be that, it's a rolling scale, and after 5 years of employment, you're 100% vested. That's just an example. Loans may also be taken from plans as well. So it's, helpful to understand those options. So just running a little bit into some compensation terms to know if you are receiving a job offer. So hourly pay and non-exempt status. So if you're paid hourly, it's a rate that you're paid for each hour you work in a standard work week. If you're non-exempt, it means that you are eligible to receive overtime pay. And so it's important to understand what that means within your organization. So it's something to take a look at. Salaried pay is a fixed amount that you're paid each week. So it's not, so if you're in a salaried role, it's not an hourly rate, it's two different things. And then exempt status means that you're not eligible for overtime pay. So you're exempt from being paid overtime. Some organizations offer bonus pay. So that might be a reward for outstanding performance, or incentive pay. So there's some roles out there that might be eligible for incentive pay. Telemarketing, for example, sales jobs, those kinds of things. So things to consider if you are offered a position is just what type of role is it? Is it a fixed term role, meaning is it going to end in a couple of months, or is it kind of an ongoing indefinite period of time? Is it, as we just talked about, an hourly rate or salaried role? What the work week is. So is it 35 hours, 40 hours a week? Important to understand when you're eligible for benefits and if you're eligible and what type of benefits you are eligible for. And then always good to ask about, whether or not there's an annual performance program. And then as part of that, is there a bonus or incentive pay? So those are all good questions to ask. And then, what's the typical growth path for an employee in this role? It's okay to ask for time to think about an offer. It's important to evaluate all the pieces and components within the offer. There could be times where if you don't feel the offer is fair, that it's okay to say, I was hoping that you would be at a different rate and this is what I'm looking for. So there could be flexibility, there as well. So lots of things to think about, from a benefit perspective and then also from a compensation perspective. But I hope that this was helpful. And thank you for listening.